Hi, I'm Dr. Stephen Gowdy, Pediatric Ear, Nose, and Throat Surgeon, Chief Medical Officer, and founder of Dr. Knows Best. So one of the worst things that happens when you're a parent of a newborn baby is that your baby gets sick. So they're having a fever, they're crying, they have a cough, a runny nose. All of those things are challenging. I know, I have 3 kids. I've been through it. It's miserable. One of the most concerning viruses that children get is something called RSV. So RSV, or respiratory syncytial virus, is a virus that is very common in babies, adults, as well as older adults. Usually it can occur when your baby has been in childcare or been in contact with somebody. And when your baby is really young, say 6 months or younger, particularly for those children that spent time in the neonatal ICU or the NICU, the premature babies, all of those, RSV can be devastating because it is a virus. There are not really any good treatments to help your child get through it other than normal fever control, respiratory hygiene, and patience. But it can really affect both the upper and the lower airway. Sometimes your baby may get admitted to the hospital. Sometimes they may actually end up in the ICUs. And because babies are obligate nasal breathers, meaning that they primarily have to breathe through their nose. And so one of those reasons why is when your baby is born, the nose and the voice box are very close together so that they can eat and breathe at the same time. So if you look at the side of the face, this is obviously an adult face, but here is the tongue here is the voice box down here, and in babies this voice box is actually way closer up to the back of the throat or the palate, and so those tissues really overlap. So the uvula, the little dangly thing in your throat, and the epiglottis, which is here and which is really down here, that's the epiglottis right there. Those get really close together so that when your baby is cluster feeding, they can breathe and eat simultaneously. The issue is that when the nose gets blocked up here, this is completely congested, they're not really breathing through their mouth, then that can really present a medical emergency. And so that's why I see a lot of babies that get admitted to the hospital with RSV just because they can't breathe, right? Just because their nose is so clogged up here that the air isn't passing here, they have to stop feeding, open their mouth and breathe, and so they get really tired. And so one of the things that you want to watch out for is if your baby's becoming lethargic or dehydrated. If they're taking longer than 30 minutes to feed, then that's going to be an issue. So ensuring that there's good nasal clearing, nasal hygiene will be the first thing that you need to do. And that's actually why I invented the NoseBot. So the NoseBot is a portable, rechargeable nasal aspirator for children that has hospital-grade suction. And so a lot of times I'll see families that are admitted to the hospital solely just to have nasal suctioning. And so our belief is that if you can get this nose clear here, they can breathe better, do it right before you feed them. So give them good breathing passage right here so they can breathe, they can eat, so they don't get dehydrated. Obviously, if your baby is demonstrating any concerning signs or symptoms of breathing issues, they're breathing too fast, they're using the muscles up in their neck, their nose is flaring, underneath their ribs is kind of pulling in, all of those signs and symptoms are concerning, and you need to talk to your pediatrician about that. So RSV is a dangerous virus that can really adversely impact small babies, particularly ones that were in the NICU, but in addition, it can actually affect older adults as well. So if they're grandparents watching your baby and they get RSV, it can be quite dangerous. But the good news is that RSV as a virus is self-limiting, don't need antibiotics, just needs time, management of fluid status, good breathing, and the ability to be watched closely, particularly if your baby is at risk for complications, particularly those babies that have been in the neonatal ICU. So follow us for more good content.